Leading a startup team, whether you're delivering a sugar rush, stocking coffee, or getting a regular delivery of snacks, Office Depot has solutions that fit every startup culture, from getting those first business cards and stationery to ordering fleece pullovers with your new logo. To learn how Office Depot and the California Technology Council have partnered to bring you savings on all of these startup essentials and more, go to californiatechnology.org/member benefits. I'm Daniel Levine, and this is the Bio Report.
One-third of adults suffer from high blood pressure, and 9.4 million people a year will die from complications relating to the condition. In fact, cardiovascular disease remains the leading cause of death worldwide. Quantum Genomics is developing a new class of drugs that target an enzyme in the brain for the treatment of high blood pressure and the prevention of related cardiovascular disease. We spoke to J.P. Milon, CEO of Quantum Genomics, about its platform technology, how it works, and why it may have promise as an approach to treating both hypertension and heart failure.
JP, thanks for joining us.
Hi, Donnie. How are you today?
Good. We're going to talk about Quantum Genomics, its BAPI platform, and its efforts to develop a new class of therapeutics to treat cardiovascular disease. We're in a world where a lot of the efforts to develop innovative therapies are geared towards cancer. Nevertheless, cardiovascular disease remains the leading cause of death. How big a problem is hypertension and related cardiovascular disease today?
Well, treatment-resistant hypertension affects an estimated of 150 million people worldwide and resulting in almost 10 million deaths from complications due to high blood pressure each year. Nonetheless, there is currently no accepted pharmacological standard for treatment. And with limited treatment options available for treatment-resistant hypertension, patient remains at increased cardiovascular risk and susceptible to the complication associated with chronic hypertension, including an increased risk of mortality.
Well, there are a number of therapeutic strategies for treating hypertension. How is hypertension generally treated today?
Well, you have today a lot of different available treatments. You are absolutely right. But despite that, resistant hypertension is treated with three products, an ACE inhibitor, an ARBs, a calcium channel blocker, a beta blocker, and most of the time the patient, they have three products, one of them being one diuretic. And still, unfortunately, there is currently no available treatment to treat hypertensive patients, the ones who are resistant. And as I mentioned before, 15% of them are still suffering from resistant hypertension. And it's more common also in minorities such as Black, Hispanic, female, and obese populations.
When you think about the problems with existing therapies today, what's wrong?
Well, I think the problem is mainly that some products like the ACE inhibitors and the ARBs, they simply don't work in Black patients, for example. This is very well known. So this is one example of why people are still dying from resistant hypertension.
Quantum Genomics is working on a platform. It's called BAPI. That's an acronym. What does it stand for?
It stands for Brain Aminopeptidase A Inhibitor. And that's a total new mechanism of action and a new therapeutic class. And Quantum Genomics is the only company developing a product in this new therapeutic class. So this is definitively, let's say, new because Fuiribastat, our product, works by crossing the blood-brain barrier and modulating the RAS, and RAS stands for renin-angiotensin system. So modulating the RAS locally to limit vasoconstriction and promote vasodilatation, thereby decreasing blood pressure. This is totally new because definitively you work at the brain level with Fuiribastat. And in the brain, Fuiribastat causes the inhibition of a key enzyme in RAS, and the name of this enzyme is aminopeptidase A. So we block this enzyme. So the name of the platform is brain aminopeptidase A inhibitor. And by inhibiting this aminopeptidase A, Fuiribastat decreases levels of angiotensin 3 in the brain, which is a key protein that drives vasoconstriction.
Well, this is a normally occurring enzyme. What's its normal function? What's its relationship to elevated blood pressure and cardiovascular disease? And do people with this problem have elevated levels, or is it just a way to lower hypertension in people with elevated levels?
Well, patients most of the time have an elevated level. And thanks to our new approach to treat hypertension and associated cardiovascular disease, I mean by that resistant hypertension, heart failure, but there is also potential for other indication. We simply decrease the vasopressin release, we decrease the sympathetic nerve activity, and we increase the baroreflex. So at the end of the day, we have three actions, if I may say that. We increase the diuresis, which is the urinary elimination. We lower vascular resistance, and we control heart rate. So that's why this innovative drug targets the new central pharmacological pathway, leading to both antihypertensive effects and cardioprotection.
And is there a way you could actually test a patient to determine whether this would be the best approach for them? Can you tell if they have an elevated level of this enzyme to begin with?
Well, there is not a companion diagnostic for that. But we don't need that because, you know, a resistant hypertension patient is a patient treated by three products, as I mentioned before, one of them being a diuretic. And then this is very simply in a way that if the patient is not a target, and the target is 140 for the systolic blood pressure and 90 millimeter of mercury, 90, I repeat here, 140 and 90, then if the patient is not a target, then it's absolutely mandatory to initiate a new treatment in order to treat the patient.
I think of most treatments having a systemic event, or rather a systemic effect. You're treating an enzyme in the brain here. Does this have to cross the blood-brain barrier to work?
You are absolutely right, and this is what Fuiribastat does. We had to work a lot also on the history, because when we define, let's say, the compound, and it started with a neurobiologist person at the INSERM, which is a research institute in France, and then we had a lot of chemistry development in order to make sure that our product, Fuiribastat, was penetrating the brain.
How exactly does the product work?
Simply inhibition of the aminopeptidase A in the brain, which will, let's say, block the conversion of angiotensin 2 into angiotensin 3. So that's very, if you take the ACE inhibitor, they were blocking in the cascade also one of the enzymes. What's different with our product is that we act in the brain, and this is the first and the unique product controlling hypertension and mainly resistant hypertension by inhibiting this enzyme at the brain level.
You actually got multiple products in your pipeline. What's the pipeline look like, and where's your lead therapeutic product in development?
So the lead compound is fioribastat. I spent 30 years in different pharma companies, and it's very common to have a lead compound and backup programs. So we're also working on different backup products, being more potent or cheaper to produce. But for the time being, we developed in hypertension, difficult to treat patient, and heart failure, our lead compound, which is fioribastat. So we just finished, by the way, the New Hope study. The study was run only in the U.S. In 38 centers, and our PI was Professor Keith Ferdinand, who is a professor of medicine at the Tulane University School of Medicine in New Orleans. And in order to be consistent with what I told you before, this phase 2b clinical trial enroll overweight or obese patients with primary hypertension, population known to have increased incidence of treatment-resistant hypertension, such as Black, Hispanic, elderly, and female population. And we got extremely good results, and I'm happy to comment those results if you want. And that's the reason why now we will initiate a pivotal phase 3 trial in resistant hypertension, which will lead to registration.
Well, what do you know about the approach from a clinical point of view in terms of safety or efficacy?
Well, we got extremely good efficacy data, and we had a very good safety profile. In the phase, in the New Hope study, again, and this product is an oral product. We had obese patients with hypertension, and those patients, we know that obesity increased by 5-fold the risk to be resistant to the treatment. And in those patients, we had a 6 month, we were 6 months ahead of schedule, and we were able to reduce the office systolic blood pressure from baseline by an average of 9.6 millimeter of mercury, which was highly significant because the target was defined by the FDA and our steering committee. The target was to decrease this office systolic blood pressure by 7 millimeter of mercury. So with 9.6, we were really happy with the results. And what I would like to mention also here is that fioribastat efficacy was also similar in the Black and non-Black populations, contrary to other anti-hypertensive classes. And this is what I told you before. The ACE inhibitors and the ARBs, they don't work in such population. And we were also well tolerated, and we were able to demonstrate an excellent metabolic and safety profile. So that's the reason why now, based on the results, we will initiate a phase 3 pivotal trial in resistant hypertension with fioribastat.
You're also developing a treatment for heart failure. This is using the same platform. Is it the same drug?
Yes, this is the same drug. We based on excellent efficacy data in animals and good safety profile in the pilot phase 2A. We will initiate. This is a work in progress. A phase 2B trial, and that will be all about efficacy and safety in patients with reduced ejection fraction after acute myocardial infarction, and head-to-head versus the reference therapy, and the reference therapy is an ACE inhibitor, ramipril.
What happens in heart failure, and why does this mechanism of action seem to benefit these patients?
Well, and in heart failure, it's a difficult disease. Many products have tried, and they simply did not succeed because the mechanism of action, I would say, is not as simple as it is in hypertension. Most of the time, the patients are suffering from different diseases, which it's even more complicated to treat the patient. What we have demonstrated is our activity on the renal sympathetic nerve activity, and also our activity on the ejection fraction. So that's definitively what we want to demonstrate in heart failure.
How is the company financed to date, and how far will current funding take you?
Well, we have, I would say, enough money in the bank to finance all our project this year in 2019. So all the project is to finance the phase 2B proof of concept study in heart failure, the pivotal trial phase 3 in resistant hypertension. We are also working on the once-a-day formulation. Today we have a BID, twice a day. And for resistant hypertension, it's very important to have a once-a-day formulation. So we are also working on that. And we have enough money in the bank to finance all those projects. At the same time, we are in close contact with a lot of pharma companies who have demonstrated an interest in our product, because our intention is to sign a partnership this year.
And if all goes well, what's the path to market? How soon might you be able to file?
Well, and by the end of 2022.
JP Milon, CEO of Quantum Genomics. JP, thanks so much for your time today.
Thanks, Danny.
Thanks for listening. The Bio Report is a production of the Levine Media Group. To automatically download this podcast each week, subscribe to our RSS feed or through iTunes or other podcast manager. To join our mailing list, go to levinemediagroup.com. We'd love to hear from you. If you want to drop us a line or are interested in sponsoring this podcast, send an email to danny@levinemediagroup.com. Special thanks to Jonah Levine, who composed our theme music, and the Jonah Levine Collective, which performs it.